The consumer survivor movement of the 1970s greatly impacted the landscape of the mental health system. Not only has the movement empowered mental health consumers to self-advocate and ensure that they themselves are the dominant voice when determining treatment, but perhaps one of the most important changes was the creation of a peer support initiative. Peer supporters are people who share their lived experience with those currently navigating the mental health system, and because of this, they are better able to relate to and offer more authentic validation and empathy. Peer support is gaining increased recognition in almost every sector of medicine, and healthcare providers are seeing the benefits of such programs in their practice. While peer support has shown tremendous benefit where patient satisfaction and empowerment are concerned, there seems to be some apprehension on behalf of many clinicians to include peer supporters in a primary role on case management teams. It was therefore imperative that evidence-based research be collected to support the necessity of including peer supporters on mental health treatment teams. The question I sought to answer concerned the quality of life of those living with anxiety. I wanted to know how traditional case management compared to peer-supported case management in terms of their effects on the WHO and HOPE scale scores reported by clients within the first year. I was particularly interested in the WHO and Adult HOPE scales because they are measurement tools that gauge a person's perception of their quality of life. They are a qualitative tool that help assess the overall well-being and not simply health in the absence of disease, like many of the other measurement tools used in this field. In this study, I analyzed previous studies that tracked WHO and HOPE survey data as well as patient feedback as a means of determining the impact that peer supports had on recovery. The WHO and HOPE results were compared between patients who had received some type of peer support and patients who had received only typical care. There were significant differences between these two groups of patients. Those who received peer support experienced a greater perception in their quality of life, as well as a much shorter recovery time. It is clear that peer support has a tremendous positive impact, at least in the early recovery phases. The response of participants all shared similar themes. Firstly, they pointed out the value of lived experience. Seeing and interacting with peers that had previously gone through like experiences generated a sense of hope and understanding of the recovery process and helped to relieve the fear and anxiety that patients had about the future. Secondly, patients agreed that interactions with peers focused more on respect, personal identity, and shared interests than the interactions they had with medical professionals who focused solely on their symptoms. These discussions not only increased a sense of hope, but patients also reported feeling understood and supported in a way that clinical interventions did not. This made them feel better about themselves and their potential as a result. Finally, participants noted that peer support helped to relieve much of the post-discharge anxiety that is common with inpatients. This stemmed from feeling less alone in the process of moving from a socially active inpatient unit to a typically isolated living condition with little to no social support. Peer supporters were able to demonstrate that it is possible to successfully make the transition and provide advice about the steps needed to support reintegration and self-sufficiency. My research has revealed that the mental health system in Canada needs a substantial overhaul. Fewer than 1 in 3 adults who experience a mental health issue ever receive services. And what is even more appalling is that as few as 1 in 4 children will get the support they need. The strength of the evidence demonstrates that implementing peer supports as an essential component of the mental health system will significantly reduce the number of crisis-related hospitalizations, cut wait times, increase recovery times, offer social support, and improve the overall quality of life for those struggling with mental health issues. The time to fully integrate peer supports into the mental health system is now, and I hope this presentation has impacted the way you understand peer support and the way it is perceived in the field. Thank you for your time, and have a fantastic day.